You're listening to Vote Her In, a collaboration between Two Broads Talking Politics and author Rebecca Sive. On today's episode, we speak with Congresswoman Lauren Underwood from the Illinois 14th District. Hi, everyone. This is Kelly, and you are listening to Vote Her In, which is a collaboration between Two Broads Talking Politics and author Rebecca Sive. I'm going to turn it over to Rebecca to introduce one of my very favorite congresspeople in the world. So hello, Rebecca.
Hi there, Kelly. And of course, I agree with you too. For those of you joining us in this 4th of July week, we're particularly delighted that we have with us today one of the most spectacular Congresswomen you could ever have the good fortune to know, watch, and support, and that is Lauren Underwood from Illinois' 14th District. As you probably know, she's at age 33, the youngest Black woman ever elected to Congress, a registered nurse, a public health expert, a fantastic role model, and since her election, her first election in 2018, she's of course running again this year. She has written several pieces of legislation that have become law, and also, excitingly, had a big hand in the passage yesterday in Congress of the Health Care Affordability Act. We particularly wanted Lauren to join us this week because in thinking about the 4th of July, of course, we think about the importance of that day in the nation's history, but in the particular context that we're now in, when, of course, as we all know, all men are not created equally, much less all women or African Americans. And so we thought it would be good to talk with the Congresswoman about what she sees happening around the country right now in the context of the current disturbances, a mild word, and how she thinks we should think going forward on 4th of July in the next few months. So welcome, Lauren, and thank you so much for taking the time. We really appreciate it.
Well, hi, Rebecca. Hi, Kelly. It's so good to be with you today. Thank you.
If you would share with us, Lauren, your thoughts as we come up on the 4th of July and how you're going to be thinking about it and what your message is going to be to your constituents.
Sure. Well, I think we have a lot to celebrate in this time, and we obviously have lots of work to do. I'm going to be spending the 4th with my constituents in Yorkville. They're having a parade that's like a driving parade through the community. And so I'll be in a car just waving and celebrating safely together. But it's also going to be an important time to be back in the 14th Congressional District since passing this important piece of legislation that we moved through the House yesterday. It's called the Patient Protection and Affordable Care Enhancement Act. And it's the first set of health reform legislation that we've had an opportunity to pass through the House of Representatives since the Affordable Care Act passed. And when I say health reform legislation, I mean cleanup to the ACA, improvements, opportunities to build upon that historic law. And one of my bills that I introduced, called the Health Care Affordability Act, was included in that larger legislation, and it passed with bipartisan support. I'm really excited to share that news with our community, because I wrote the bill in direct response to what my constituents have told me, which is that healthcare premiums are simply unaffordable. In our community, the average income for a family of four is about $100,000 to $105,000 a year. It is not uncommon for folks to be paying $20,000 or $25,000 on their premiums alone to buy a plan on the marketplace. And so what this bill does is that it lowers the cost of their premiums, right, that out-of-pocket cost. And so it would limit it to 8.5% of adjusted gross income for that silver level plan, which is good coverage on the marketplace, which is a dramatic reduction from 20 or 25% of their income. So, for example, a family of four making $60,000 would save an additional $2,000 on their premiums. And, that is significant. I'm also excited to be able to continue to have this conversation with families throughout the 14th after, the deaths that we've all been collectively grieving of George Floyd and Breonna Taylor and Rayshard Brooks and Ahmaud Arbery and so many that we have lost over the years as a result of policing or systemic racism or white supremacy or all these issues that we've been talking about in our country. Grateful to have the opportunity to continue that conversation with folks on the 14th. And you're right, I did have a role in crafting the George Floyd Justice and Policing Act. Really proud to be able to vote for that bill on the floor of the House last week. Again, we got bipartisan support for that legislation. And, we really met the moment. We've been dealing with systemic racism in this country for 400 years. And it's expressed itself in a number of ways in all of our lives, right? Thinking about inequalities in education system and housing and healthcare, and obviously in our criminal justice system. And when I think about opportunities for federal intervention, I think that policing is such a wonderful place to start. We can talk about how we want our communities to feel safe. We want our residents to feel protected, but we also need to foster a culture of accountability and transparency and justice, right? And this legislation gives all of our communities the tools to do just that. I think that the media has characterized this policing reform effort as a solution for the Black community. And I think that that is so far from the truth. These reforms help all of our communities, including those in Northern Illinois, be more safe, and it gives folks the tools. I think that we can heal our country from racism. I think it's going to take a lot of active work, intentional work. It takes work to build bridges and to come together and to unify. It's not something that can be done passively. If it was just going to happen, it would have happened over these 400 years, right? But we have to actively do it because the divisions in our society are deeply rooted. They've been used as political ploys to try to separate us, to make us look at our neighbors with suspicion and fear. And so we have to decide to stand up and say no to that kind of politics. And this bill is a good first step in that regard.
So it's been a really big week in Supreme Court decisions, couple weeks in Supreme Court decisions. And there was just a decision that SCOTUS knocked back a Louisiana law that was going to really restrict abortion rights. You've been pretty vocal about the importance of healthcare for women. And with Congresswoman Alma Adams, you launched the Black Maternal Health Caucus. Can you talk some about that and the kinds of policy changes, the kinds of funding that you would like to see to really help support Black maternal health and what that would mean in this country?
Yes, I was so happy to see that Supreme Court decision. And obviously, as a nurse, I support women's right to the full range of reproductive healthcare services without restrictions. And that includes access to safe, legal, and affordable abortion. But I also want to tell you why women's health and maternal health care in particular is important to me. So when I was in graduate school at Johns Hopkins, I had an incredible friend. Her name was Dr. Shalon Irving. After we graduated, she went on to become a lieutenant commander in the United States Public Health Service Commission Corps. She worked at the Centers for Disease Control and Prevention as an epidemiologist and had focused her career on ending health disparities. Shalon was also an expectant mom. She was so excited and gave birth to her beautiful baby daughter, Soleil, in January of 2017. And 3 weeks after giving birth, she died due to complications from her delivery. And, that was a shocking loss to me. And listen, as a nurse, right, we know about these disparities in our healthcare system. And even the maternal mortality rates, I knew it in an academic sense. But to witness this happen to someone that I cared about and, someone who had, quote, done everything right was just shocking. And, it shouldn't have been, because in the United States, Black women are 3 to 4 times more likely to die from pregnancy-related complications than white women. In our state in Illinois, Black women are 6 times more likely to die than white women. And, this has been the case my entire lifetime. I'm 33 years old, and this disparity has persisted. We've not seen, right, large federal, national initiatives to end this disparity and to save moms' lives. And so, when I came to Congress, I knew I wanted to work to solve this problem. And so I teamed up with Congresswoman Alma Adams. She's from North Carolina. And honestly, I thought it was just going to be the two of us working on this issue. But we wanted to give ourselves a name because that's just what you do in Congress. And, it turns out so many colleagues wanted to join us. We are now up to over 100 members. It's bipartisan. And in March, we introduced something called the Black Maternal Health Momnibus Act. So it's like omnibus, which is congressional word for a collection of bills that have been put together and into one legislative package, but for moms. So it's called Momnibus. And it's 9 pieces of legislation to comprehensively address the maternal health crisis in our nation. Some of the bills have bipartisan support, and I'm really, really optimistic that we're going to be able to see this legislation get full consideration in the Congress, over to the Senate, and off to the president. I mean, the time for action is now. We cannot wait. And, we've been making some progress. Like yesterday in that big healthcare bill, we were able to include a Medicaid expansion to extend coverage for women in the postpartum period from 60 days to a full year, right? And that is the single most important thing that we could do to save moms' lives in that postpartum period. And so we're making good progress. We have a little ways to go, and we're so excited about the Momnibus.
So, related to that, Lauren, and of course you know this too, it's women legislators and women elected officials who are the ones who put forth policies like the one you're discussing and projects like the one you're talking about that aid women and girls. And in that context, of course, we're all thinking right now about Vice President Biden's commitment to select a woman as his VP candidate. Obviously, it's particularly significant in light of the times and also the fact that several women ran powerful campaigns for the presidential nomination. There's also been a lot of discussion about the importance of selecting a Black woman. And last, I would add to this mix all the attention that's been given and paid to, deservedly so, to the women mayors of big cities who've been working to help families in their communities. So I'm wondering in that context, if you could talk with us, we won't ask you who you want to endorse, but I know that would be asking you to sort of look around the corner there. But what's really important, I think, is your view on the key qualities of this prospective nominee, what kind of messages you want to hear her underscore, what kind of legislation you'd like to see her advocate.
Yes, I am very excited that we will have a woman VP nominee. I think we have such extraordinary choices, and the vice president really just has like an overflow of riches right. when it comes to the women that he has to pick from. I am particularly enthusiastic about the women of color that have been widely discussed as being part of that shortlist. And I certainly think that that is an appropriate direction to take during this moment in our nation's history, right? In August, we're going to be celebrating 100 years of the women's right to vote. I came in to Congress with the most women serving in the United States Congress in our nation's history. It's also, the largest incoming class of women of color. And when I think about the voices coming out of Capitol Hill, it is the voices of women that are right. The strongest, boldest, most powerful voices. And in many instances, outside of Madam Speaker, who we love, these are women of color. And, that dynamic is a dramatic shift for Washington, D.C. It has made some people obviously very uncomfortable to see young women of color speaking so boldly. And I think that, we have just collectively, the women in Congress, been so effective in getting things done, delivering for our communities, bridging divides and working together and, not just falling prey to this partisanship and, the gridlock that has, so characterized an institution for so long. And I think that, this spotlight on women's leadership will be transformational for our country moving forward.
Is there a particular message for these times? If you were writing her nomination speech at the convention in August, what would you recommend to her or whispering in her ear?
Well, I would just speak to the many people, because it's not just limited to women, who have not seen themselves reflected in, leadership that's coming out of the White House, don't recognize their values in the values that the Trump administration has, really let guide their actions. And, let people know that we hear you, we see you, and we are here to serve you. And then that message of, service and commitment to the American people
Right.
is something that I think is going to need to be so central to this message. I think that there's a lot in the imagery, and there's a lot in each of these women's personal stories that's going to be so compelling as the American people get to know them, their strength, their intelligence, their effectiveness, their grace, their humor, right? And all these different things. These are just dynamic women. But I think that a larger message of unity and leadership and understanding, and it's going to be critically important for our nation to just, quite frankly, heal from a time that has been so deeply damaging, and, start to repair our relationships with one another as neighbors, and then our relationships around the globe as well.
So we're talking to you here. It's the beginning of July. It's just 4 months out from November, the election. You're running, of course, for re-election in the House, and it's different this time around, right? 2 years ago, you flipped a district. Now you're the incumbent in what's a very sort of swingy district, and the whole world looks different now, and elections look different now. Campaigning looks different now because we're in the midst of a pandemic with voting by mail and the inability to have large rallies. So what does running for re-election look like for you right now? How do you accomplish this? And how can people sort of help out? 2 years ago, I was out there knocking on doors for you, but not something I really feel comfortable doing at the moment. So, what can people be doing?
So listen, when I was elected in 2018, my promise to my community was that I would carry their voices and values with me to Washington. And literally everything that we've done has been in partnership with our constituents, right? We've been laser focused on healthcare. And throughout 2018, I spoke about people who literally couldn't afford their insulin. And then in the end of 2019, the president signed my bill, the Lower Insulin Costs Now Act, into law, right? And that's a bill that makes generic insulin, low-cost generic insulin, available on the marketplace sooner. And that's a bipartisan victory. We got it done to deliver for people on the 14th. It's also been really important to me to have an open, transparent relationship with our community. I said at the outset, I wanted to be the most accessible, transparent, and responsive representative that I said Congresswoman that the people in the 14th would have ever seen. And that means that we need to engage our community, all of our constituents, regardless of whether they voted for me or not. And so we've had town hall meetings all across this district, and I call it going on tour, and we've done it several times, going around to all 7 counties. And, due to COVID-19, we've had to change the way that we do that work, right? So Facebook Lives and telephone town halls and other, virtual meetings, but we're still keeping up that engagement. And so I would just say that my campaign is just really about continuing and expanding the relationship with the people of the 14th district throughout Northern Illinois, talking with them about the successes we've had, the work that we still have to do, and then really just listening about, what they want us to prioritize next and how to be involved. I would just say, listen, we are getting started right now. So phone calls, texting, postcard parties. And when I say postcard parties, I mean, like, get on your, virtual chat platform that you like with your girlfriends and bring out these postcards, and it can still feel like this communal, fun environment. But we're doing this critical, important voter outreach that reminds people to vote, reminds people to fill out that absentee ballot request, etc. And so, I'm really excited about this new way of campaigning, even if it's different than anything we've seen in the past.
You know, when you talk about this new way of campaigning and the old way of campaigning too, of course, you're modeling for other women who may want to follow in your footsteps how to do this work, what to think about, what messages are important for people you're wishing to carry over to your cause to hear. Can you share with us, you know, in a sort of closing here, what kind of advice you share? I'm sure young women are always pestering you for pictures and comments. Can you share with us what you think you really want to stress to these women when you're meeting with them, what you say to them?
So when I meet with groups of young women, we meet with like interns that are working on Capitol Hill, or sometimes I'll do like conferences and keynote speeches and things like that. What I always tell young women is to focus on doing the work and don't focus on chasing a title. Because if we let the work guide us, we're going to be able to build this resume of incredible accomplishments and impact that, you know, our value to an organization and our value to the community will be undeniable. And as I think women come into their careers and start to think about additional ways to have impact, I always, always, always encourage women to run. You know, there's something that happens where we start to think that maybe we're not credentialed enough. We haven't accomplished enough. We are somehow inadequate and we need to do more, learn more, accomplish more, do something else to be able to show and prove to our communities that we would be excellent policymakers. And what I always tell women is just like, girlfriends, we need you to run. You are so powerful as you are. And that if we continue to self-select out of stepping forward to run, we are denying our communities the opportunity to move forward with, the best judgment and the best experience and all of our incredible leadership skills that we have to offer, right? Someone else will be there making those decisions and they just don't have the rich perspective that you bring. And so I just always encourage women to run, that their communities will embrace them and that they are more than enough.
And on the note of being more than enough, but you still have to get elected, would you share with our listeners information about the website, the campaign address,
Yes.
They can get in touch with you, and then just a note of a great thanks, Lauren. I know that you talked with Kelly when you first ran, and you and I have had occasion to talk over the years since, and it's just energizing to hear from you today. So thank you.
Thanks, Rebecca. Thanks, Kelly. So listen, everybody can keep up with us on online. Our website is Underwood for Congress, and it's forcongress.com. You can find me on Twitter at Lauren Underwood, on Facebook at Underwood for Congress, and on Instagram at Lauren A. Underwood. And the secret is on Instagram, that's straight from me. So, we don't post all the time, but when you do, it's me. And, I love just, keeping in touch with everybody and, seeing what's on folks' minds. And we're just really excited about, the campaign this summer and into the fall, and we need everybody's help. So please visit the website, sign up to join us for phone calls, texting, and postcards, and we'll put you to work, but I promise it'll be fun.
It will be fun, and I've got to say, you're the only congressperson I know who actually recognizes me by sight when you see me. So.
Oh my gosh, yes. Well, it's been a long time, and you were there, real early in the primary.
Yeah.
When I was still walking around having my campaign in my backpack. I think we have a picture together with the backpack. But, that's part of what makes this great, right? Is that we have an opportunity to grow together and to do this work together. And that is the story of the 14th Congressional District.
So, Lauren, thank you. We will look for you in the digital and the real world. And in the meanwhile, take good care this week.
Thank you. Good to see you.
The Vote Her In segment is a collaboration of Two Broads Talking Politics and author Rebecca Sive. Our theme song is called Are You Listening, off of the album Elephant-Shaped Trees by the band Immunuri, and we're using it with permission of the band. Our logo and other original artwork is by Matthew Weflin and was created for use by this podcast. You can contact us at twobroadstalkingpolitics@gmail.com or on Twitter or Facebook at twobroadstalk. You can find all of our episodes at twobroadstalkingpolitics.com or anywhere podcasts are found.